So this is an exercise called rocking that we tend to give all patients at the Sussex Back Pain Clinic. It's a really valuable exercise for multiple reasons, which is why we give it so ubiquitously. So, Will, I'm going to ask Will to come into an all fours position. Really important to note is the stacked position. So knees are under hips, and then on the other side, wrist under the elbow, which is under the shoulder. So a nice stacked position. Now, the first thing is I like to say, no angry cat. So Will, show me an angry cat. There. We don't want that. We want a nice, chilled out, relaxed cat. So the first thing I ask people to do is to just relax in this area here, as Will's done very nicely here. And then the first step is just to rock back so your buttocks touch your heels. Good. And back to the starting position. Perfect. So let's do that again. Let's call that step one. So firstly, no angry cat, and then secondly, butt back to heels. Now, and beautiful, come back. The next step is to think about rolling into a little ball like a hedgehog. So as you rock back onto your heels, you're also going to think about coming forward and relaxing the neck and sort of rolling into a little ball like this. And then as you come back, you straighten up. So let's see that again. So we're not just rocking back into the heels, we're also relaxing and rolling into a little ball. So we get a nice curve of the spine in this position and back. So that's step two. Step three, I like to add some breathing into this exercise. So as you have probably been told by your clinician, by your therapist, generally speaking, flexion motion, so bending forward, is coupled with exhalation, and extension movement, so opening up, bending back, is coupled with inhalation, breathing in. So we breathe out, we flop down, we breathe in, we come up. So we're going to do that with this movement here. So as we're flexing, so rocking downwards, we're going to exhale. So Will, in this position, you're going to take a nice deep breath in, and then we're going to move on the exhalation breath down. Really good. And then coming up, we're going to inhale. So inhale. Good. Let's go again. So exhale on the way down as you curl up like a little hedgehog. And then inhale as you come up. So the third step is to couple the breathing with the movement pattern. And then finally, for a gold star, I like to think about people leading with their head. Now, what that means is the very first thing, for the first split second of the movement, the very first thing that should move is the head. So Will's going to demonstrate, firstly, not doing that. So he's going to move his back first and then remember his head. There we go. That's what we often see people do, sort of lack of coordination. And then come back up, yeah. But we want everything to initiate the movement. Just for the first split second, you want the head to start everything. So show us that, Will. Good. Come down, and then the same here. The first thing that moves is the head. Yes. And that seems to help people take a little bit of the extra pressure off this, and extra tension away from this thoracic spine. So we're just going to finish. Will's going to show us one perfect roll, rock down and back up for us with breathing. Yeah, so breathe out and in. That is the very important rocking exercise.